Okay, this is another feature session with 3 speakers. I'll introduce them all separately as they're about to come up, but each showcases a particular program developed by an agency in response to a specific need in their area. So it's a very practical presentation. Our first speaker is Katia De Silva. She's from La Trobe Health in Gippsland. She started there 8 years ago as a trainee dental assistant and since then has worked as a project officer for the Gippsland Oral Health Consortium. She's the OH&S representative for dental and is now in a senior dental assisting admin role. She decided this is a quote, I'm not saying this, she decided she liked teeth so much that she even married her favourite dentist. Part of Katia's current role involves coordinating dental treatment for a drug and alcohol rehabilitation facility at Windana, and today she'll take you through her experience of coordinating the Windana program over the last 18 months and the positive results it's had on both the team and the patients. Thank you. Katia.
Hello.
Hello.
All good? Beautiful. So yes, over the past 12 to 18 months, we have done a program at La Trobe Community Health with Windana, a drug and alcohol rehabilitation clinic. Windana provides alcohol and other drug treatment services to help those that are affected to really try and rebuild their lives, and one of those services is their therapeutic community. So this is a drug treatment service that is in Maryknoll, about an hour out of Melbourne, on 40 acres. It's just surrounded by bush. It's a really beautiful area, and the residents are generally there for between 3 to 9 months and start thereafter first doing a drug detox. So during their time there, they learn new social and practical skills to equip them for a successful life back in the community. So while they're there, they have a huge range of services offered to them. So this can be their medical case management, naturopathy, mindfulness groups, art therapy, all kinds of things, including relapse prevention. And it's all about exploring their own life experiences and learning from those, as well as the peers that they're there with. And it's all about change and growth in a supportive and non-judgmental environment. So historically, La Trobe Community Health hasn't had a specific program to target this particular group of patients. Our previous experience with this kind of a group had shown there was issues not only with really common oral conditions such as your very poor oral hygiene, no motivation, rampant caries, but also with any compliance in attending their appointments, completing treatment, any attempts to improve their oral health. Really frustrating for a lot of clinicians to do that treatment. But Windana got a new CEO, and she had previously been an executive at La Trobe Community Health, and she knew that we had a commitment to assisting these vulnerable groups, and she contacted our CEO, who really gave us some support to get this program running to treat and target this particular group of patients that while they were being cared for, so that we could potentially try and improve some of those challenges that we'd been facing and target those issues. So our manager organised for us to have a presentation done by one of the Windana staff, tell us a bit about the services, what the patient's needs were, to give us a bit of a heads up, and our manager assigned me as a project worker on this. So initially staff weren't jumping at the opportunity to do this. Automatically we think about drug and alcohol users being in withdrawal, being aggressive, having all these issues, meth mouth, huge job to take on, and it was just too much. But we kept on going with it, and we started off by doing some screenings. So we went down to Windana, a dentist and a couple of DAs, we all headed down there, and we had we were handed over to the residents of the place, and they took us on a tour of their farm. They showed us what they were growing in their veggie patches. They cooked us lunch. They were really hospitable to us. They helped us find a place that we could set up our portable equipment. So we wanted to think about being able to wash our hands. Did we have enough space? Was there enough lighting? Was there privacy for these patients to discuss personal stuff? We were able to give medical histories out ahead of time so that they could all be filled out comprehensively. beforehand. We found the closest radiography clinic in case anybody needed OPGs done. It was convenient for them and wasn't putting them out. We used our portable equipment. We screened all the residents down there, and so easy to get medical clearances if anything was needed because they were all under the care of a GP there. And Windana just organised their payments for us and made it all very easy. So when we utilised our portable equipment, there was a few OH&S things we needed to take into account. Some of this equipment is over 20 kilos, so we needed to be mindful that people had manual handling training or that there was always 2 people doing it. We utilised those trolleys that were provided. And along with that equipment comes trip hazards as well with all of the cords. So a few things to keep in mind. Sharps, we were using disposable exam kits. We had a whole lot of probes that needed to be thrown out. Windana was great. Drug and alcohol treatment services are likely to have sharps buckets all on site and help you out there. But also lighting. In the end, we were in a bedroom of one of the workers at Windana. So there was one door, one light. You can see it in this picture over here. If the door was shut, then we couldn't see a thing in there. But if the door was open, well, we had a lovely day and a nice sunny day out there. It was full of flies and it was a bit gross, but we made it work. It was fine in the end. And just a few of the consumables. So with doing screenings, it is really easy. The portable chair, the light, a chair for the clinician, some disposable stuff, very easy. When it came to doing some ongoing treatment after we'd done those screenings, and we had a rough idea of what needed to be done, we just left a few weeks between those appointments so that these guys had time to have these medical clearances done if they were needed. They could have their OPGs taken, and so when they came down to their first appointments, we could do a really comprehensive treatment plan for them and get started on them. We put blocks in titanium each week so that we knew there was consistency for the patients, for the staff to know what was happening and when. We had 60-minute appointments for each patient, which just allowed us to do that little bit extra treatment rather than just one filling at a time. Kept a track of the patients in an Excel spreadsheet, which was just who needed to be seen urgently and had pain, who was finishing up at Windana soon, what treatment was required, just to keep track of everybody there. And we tried to see anybody who was in pain first up, get them happy, and then keep on going with that. And I just had a liaison officer, David, there that I contacted each week to book all of these appointments. So the expectation and the reality of the treatment requirements. As I mentioned earlier, we were expecting potentially quite aggressive clients because we hadn't realised they'd already gone through that detox before they started with us. And Windana also has a zero tolerance on aggression policy, as do a lot of other drug and alcohol rehab centres. So there was absolutely no issues there. We found that the patients were all actually really motivated to improve their lives. They're voluntarily at Windana. They want to get better. They want to improve their oral health, their general health, their lives. And there was just, no compliance issues at all that we'd previously had with this kind of patients. So medical history-wise, like I said, they were all under the management of a doctor at Windana, so any medical conditions that they did have were being really well managed, and it didn't affect their treatment plan with us at all. And for that treatment, there's a few different charts up there that you can see. So yes, there was a few that had quite rampant caries throughout their mouth, but some of these patients just needed a scale and clean or a splint made. Some of them needed absolutely nothing. So no different to any other patient that we were taking off our waiting list and seeing. Starting out, we did have a few teething issues just with communication between the whole team, the dental team, your reception, everybody knowing what was happening and when, who was organising appointments and payments and stuff like that. Making sure the patients knew all the treatment costs before they came in, so whether that was just for general treatment, whether it was for dentures. Me being on unplanned leave speaks for itself, and transportation wasn't one we were expecting to have issues with, but one day their bus did break down on their way down on the side of the freeway, and we didn't want 4 hours of empty in our books, so our managers were quite happy for us to grab their cars and go and look for them on the freeway and bring them all in so that we could do that treatment for them. So far we have treated about 70 different patients over around 200 appointments. So we've completed general course of cares on only about 25 of those, but That's because they are either still having treatment with us or they've discharged before from Windana before they're finished with us. So they all know that they can continue to come in after they're finished up at Windana, and we have had a couple of those patients come in and finish their courses of care with us. Now all new residents coming through the therapeutic community are given exam appointments and given the opportunity to have treatment if they want it. And there's just a couple of quotes up there from staff who have been working with these guys who really do have a whole new appreciation for them. So you've got to admire these people for trying to clean up their lives. It's not easy for them. Somebody else just said they've been such good patients. They're so grateful and appreciative, and they've really enjoyed working with them. And we found the beauty of looking after these clients while they're in rehab is that you're not having to rely on a client to get to their appointments on time, to organise transport, to organise payment. They're under care, they're being looked after, somebody is organising all of that for them. So a few weeks ago we got a letter from Tim, who was a client that we finished up his general course of care with him a few months ago. And he said, before I came to Windana, my dental hygiene was very poor. I had lost a lot of teeth and I was in constant pain from reoccurring infections. So Tim was one of the guys that we did have to do a full clearance on him. He did have a mouthful of abscessed roots in there that were causing him a lot of problems. And these extractions that he had coincided with his reduction of pharmacotherapy at the therapeutic community. And he said after that he improved quite dramatically, gaining weight, sleeping better. Then I began my process of getting dentures, and this has been one of the motivators in my program. I'm very grateful to Windana and the dental program for facilitating this dental treatment. I feel healthier and I'm able to eat better. Now I can smile broadly without cringing inside. I've gained a lot of confidence and feel more positive about my appearance. Thank you. So that was really nice to receive that one from him. If you are thinking of implementing a service like this in your agency, I do think it was really beneficial to have a presentation from a rehab clinic or whatever the thing is that you're going to do, so that staff can get some kind of an idea of the needs of clients and to help engage them. Have a project worker, somebody that's their job, that's their focus, to make sure that these appointments are booked, that these people are looked after and that their needs are being met. And it's really important to have a dedicated liaison officer at the service that you're coordinating this with. So somebody you can rely on to make sure these appointments all happen. Think about having regular blocks in titanium. The length of the appointments, it's going to be different for whatever service that you're offering, obviously. But continuity of care for these guys was really important. They needed to know that whoever was looking after them knew what their treatment was, knew what they needed, and that they could trust. And just the time of day that you might have these appointments. So for Windana, they were coming from over an hour away. It didn't suit to have 8:30 a.m. appointments just in case something came up on that morning. So again, if you're considering doing a program that focuses on drug users, I'd really recommend reading this article in the British Dental Journal. That just has a quote in there saying, the recovery from drug use can be seen as the reconstruction of a non-addict identity, a process that might involve reconstruction of the body and its associated focus on health. In order to do so, the recovering user has to develop a range of new activities and relationships to sustain their new identity. It is at this point that the reconstruction of the mouth and teeth can become of central importance. So somebody trying to find this non-addict identity, they need new friends, they need a new job, they need recreation where they're not associating with other drug users. And humans do tend to be pretty quick to judge that if somebody smiles at them and they've got a mouthful of bad teeth, you just take a step back and you go, ooh. So realise that, don't judge these people. Know that what you're doing is really important to them and they really do appreciate it, and you are potentially making a massive, massive difference in their lives and helping them transform that. So next we have our keypad question. So I mentioned earlier that our CHS has a commitment to assisting vulnerable groups, and it was the leadership from our CEO that helped initiate this program, and it was pivotal in getting the program up and running. So who can take on this leadership in your agency, do you think? Yay! So yeah, everybody can play a part. It is really important to have that support from your management and from the exec, but everybody can take on responsibility and help get these programs up and running and really make a difference to your community.